Hi guys, this is Dr. Brian Opp here with Opp Family Chiropractic right here in St. Francis. Today we're going to talk about cranials. And we have Emily, our craniosacral therapist. So we're going to ask a few questions and answer a few questions that you guys might have just about craniosacral and what is the other technique you do? The body balancing?
Yeah, dynamic body balancing.
Cool. All right, so let's start off. What is craniosacral therapy and how does it work?
Craniosacral therapy is a really gentle, hands on therapy that can help release tension in your body. And it works by just a simple hand placement or finger placement at certain parts of the body, and you kind of just feel for that release of that area.
Okay, cool. All right, number two, what is dynamic body balancing?
So that takes craniosacral therapy kind of one step further to help with myofascial unwinding. So craniosacral therapy is a really calm, almost relaxing therapy. Dynamic body balancing kind of involves the whole body and gets you moving to facilitate the unwinding of your fascia.
Yeah. So how I like to describe fascia is it's like the saran wrap of your body. It is technically, some people might even call it an organ, but there isn't an area that it doesn't touch in your body, from your organs to your muscles to your skin. So it's that white stuff you often see if they pull the skin off there. How does dynamic body balance integrate with craniosacral therapy?
So, like I said, dynamic body balancing kind of just takes craniosacral therapy one step further.
Mhm.
So it it the hand placement is the same or similar in a lot of areas. Dynamic body balancing kind of feels for movement in your body and facilitates that unwinding, and it can focus on extremities. Craniosacral therapy focuses more on the spine and the head, where dynamic body balancing, arms, legs, all of your joints, and can even work with pregnant women on the uterus there.
Very cool. Who would or could benefit from this type of therapy? So give me a couple of examples of, let's just say, a straight craniosacral therapy patient that might come in. How would you determine if they were just like, yep, you'd be a good candidate just for craniosacral therapy?
Um, you know, I I really think anybody can benefit. That seems really broad, but truthfully, so many people snore or have been in a car accident or biking accident even when they were kids. Everything from when you were born to now. If there's something going on, craniosacral therapy can address that. The When you address the tension, the body kind of just chooses to heal.
Yeah. Yeah. One of the most common things that when I talk with patients is, car accidents, if they just have been in a stressful situation, whether that's, some long-term relationship, somebody passed away, they're trying to come up with, they're just under a lot of job stress, all types of things, because that really affects that whole aspect of your well-being. So mind, body, spirit. And so we're really trying to address that emotional, sympathetic nervous system. So when you're in that fight or flight, so we also go fight, flight, and tight. So we tend to want to be into that area there where we're in protection mode. So we need, in order to flourish, to digest your food, you need to get yourself out of that. So let's go to the dynamic body balancing. So what type of patient, how would you determine that type of patient over a craniosacral therapy patient?
I kind of look at everybody through the scope of both, truthfully.
Yeah.
But I think Dr. Brian, you touched on a lot of like the more deeper things. So emotional trauma that you can be experiencing, our body holds on to a lot of that. And so dynamic body balancing helps bring that to the surface and helps your nervous system heal.
Yeah, it's very cool. We deal 75 to 90% of all office visits are due to some kind of stress. The body takes a perfect scorecard, and if you're like any one of us, we like to bottle up things inside and go about our day. We don't know how that impacts us until later on, right? So yeah, that's good ideas. Is this is craniosacral and dynamic body balance, is this kind of a generally safe thing to do?
Oh yeah, 100%. I personally haven't experienced someone who shouldn't do the therapy. I yeah, that's really it. Good for kids
Yep.
and adults.
Yeah. When we first started out, we had a lot of kids do craniosacral therapy. My wife, Dr. Cindy, did a lot of that. So yeah, if you got kids that are dealing with things, whether it was like she did a lot of autistic kids,
Yeah,
ADHD, learning disabilities. Yep, all those are in the wheelhouse of these types of therapies to be able to help with that nervous system to get them, because often they're withholding something, they're holding something into that sympathetic nervous system, so that fight or flight. And we need to get them into that rest and digest, that relaxation mode, so that they can process things much easier and not be so how would you say that, like with the environment just attacking, they're with the outside environment, so they just get overstimulated there essentially.
Yeah, not so absorbent of the world around them.
Yeah. And pretty much anybody could be that way. Like, how are you reacting to all those things around you?
Yeah.
If you're finding that you're getting sad, angry, you're fearful of things, often we're holding stuff in, and this can definitely be a very worthwhile thing to look at.
Yeah, I have 2 kids under 2, and there are times where I'm just not able to deal with the stress of having 2 kids that little, and I know, like, okay, it's time to just like get back to the balance that craniosacral therapy and dynamic body balancing offers.
Yeah, totally. I mean, we always forget, especially when we're the parent, we are so focused on the children, and we forget to do yes. So it's a very common. I always say that moms are always typically one of the more
last to heal, but the ones who should probably do it first.
Yes. So tough to take care of somebody else if you can't take care of yourself. So, all right, last question. And one often that we get asked is, how often should someone expect to come in? And I know this can be variable, because if somebody is in a car accident, we often have them come in, more. If they're dealing with, migraines that they get on a daily basis, you're going to be coming in more often, things like that. So more of the acute and then the chronic stuff. So
yeah, I think that just like chiropractic, craniosacral therapy and dynamic body balancing is such a transactional experience that it takes a minimum of 2 hours. So that's 4 appointments for us to really build a relationship and be able to get even more in depth. So definitely plan on that 2 hours. But if it's something that's chronic, that's been going on for a long time, I would plan on a couple months worth of time.
Yeah, a good rule of thumb that I often will tell patients is, how long have you been dealing with this in years? So give me that many months. People come in like, I've been dealing with this for 15 years. Like, okay, we're going to have to do some work, right? And so it just sets an expectation that this is going to be better tomorrow, right? A lot of times, but we still want to give them hope that we are going to make, a good effort moving forward. And so this is something we're really excited. We've always been excited and done craniosacral, the dynamic body balancing. That's new in our office. So super excited for that. And its impact that it's already had on a lot of patients. So if you guys are looking at, this type of therapy that you need or want to learn more about, you can obviously call the office. You want to come in and experience a session, please do. It's definitely worth your time and effort to be able to take care of yourself and help with so many different things in your overall health. So thanks, guys. We hope to see you soon for either craniosacral therapy session or the dynamic body balancing session. So thanks, guys.